It's a real honor for me to address the importance of global health in a time of turmoil at this webinar today. The world is indeed in turmoil. Ignorance of planetary boundaries of the past is haunting back on us now. Epidemics, pandemics, environmental crises, climate change, social disruption, war of aggression in the midst of hate and fake news in the net. This young millennium has started with crises, and it seems we are hopping from one to the other. They all have health impacts on all of us, especially on disadvantaged groups of our societies. And they all have one thing in common. As citizens, it feels that we are disabled, disempowered, disillusioned about functioning governance mechanisms. Something is happening in faraway China, and it impacts my life over 2 years and counting. Out of the blue, it feels, we are confronted with ever more complex crises, and it is difficult to cope. What role does global health play in all of this? For ease of reference, let's define global health as those health issues that transcend national boundaries and governments and call for actions on the global forces that determine the health of people. So in my lecture today, I will not look at public health action from promotion to palliation that evolves through factors well confined within national borders and which are dealt with within national boundaries. I will look at risk factors to health that are fueled through transboundary interests and actions, even at local and community level, that call for a global response. Let me start with pandemic risks. The current pandemic did not come out of the blue. COVID-19 was the seventh in this young millennium. It was predictable. The global public health community warned global leaders many times over. The acute risk was discussed with G7 and G20 leaders. Leaders of G20 even engaged in a simulation exercise that laid weaknesses bare. WHO said that it would not be a matter of whether or not we would face a severe pandemic in the future. The only question would be when. A series of expert committees identified the severe weaknesses in countries that needed an urgent fix. And what did the world did? Little. This lecture is thus a call to not repeat this mistake. The world now pays dearly. We today published the current data on excess mortality. At least 13.5 million lives were lost due to COVID or related under or non-service for people with chronic health conditions. Inequities aggravated, leaving many more people behind. It is widely recognized that the most important influences on health lie outside of the health sector, in the economic systems that provide our material needs, the social systems that support us and give our lives meaning, and the ecological systems that are the root source of all health and well-being. All of these systems are drastically out of balance, resulting in multiple complex and often global challenges. International tensions are spilling over into war, and social systems are struggling to keep pace with the transitions, including population aging and increasingly online societies, leading to social isolation, loneliness, and rising levels of mental illness. Global economic growth and technological innovation are not directed towards improving human well-being as a whole, with the benefits instead accruing to fewer and fewer people, and numerous perverse commercial incentives for choices that harm health. Planetary boundaries are being breached, resulting in environmental degradation, including the climate change, which is undermining all of the determinants of health and threatening to destroy entire nations. The world has changed dramatically over the past 5 years, as has the global health environment. The centrality of health as a precondition for development, security, and human rights has been highlighted by the impact of the COVID-19 pandemic. Conversely, the COVID-19 pandemic has illustrated the importance of the environmental, social, and economic drivers of health. The virus most likely emerged from human interactions with the natural environment, and the response has been hampered by inequity and lack of solidarity within and between nations and through misinformation. As societies are now making massive investments to recover from the impact of the pandemic, there is a need to ensure that they do not simply flow back into the same development patterns and practices that increase the emergence and spread of new diseases and exacerbate vulnerabilities to all health threats. At the same time, the war in Ukraine, this unnecessary aggression from Russia, which could have been prevented with better diplomacy, including serious listening of the world to potential worries, is a stark reminder that without peace and security and an effective multilateral system, we cannot protect human health, including responding to the global systemic challenges facing the world. Identifying the promotion of health and well-being and the prevention of disease as the first strategic priority for WHO presents a huge opportunity to turn the tide. Over 65% of the global disease burden can be prevented through addressing environmental, social, and economic risk factors and conditions that impact health behavior. These actions can bring massive gains in health equity, most importantly through addressing the rising health, social, and economic burden of NCDs. 85% of deaths occur in low and middle-income countries, and within rich nations, risk factors and burdens are much higher among poorer and more vulnerable sections of society. This will render very large benefits through reduced financial and human resource costs, and increased efficiency and resilience of health systems, while also supporting poverty alleviation, economic development, and equity for society as a whole. The COVID-19 pandemic is perhaps the last wake-up call for the world to understand the importance of health for the way we design our societies. Some economists estimate the direct costs as of today at $6 trillion, which is 2/3 of annual global GDP. We now see that health impacts all walks of our lives. Health impacts mobility, trade, the service industry, banking and finance, employment, our social life. And we start to understand how fundamental this global societal disruption is if health impacts of policies are not considered. It would be a huge mistake if the world would not learn from this crisis and fundamentally address existing weaknesses. Other crises, such as H5N1 12 years ago, H1N1 10 years ago, and Ebola 5 years ago, could have served as wake-up calls. Unfortunately, the world reacted with relatively small adjustments. The recommendations of a range of expert committees that unanimously called for health in all policy approaches to assess health impacts and risks that could lead to future outbreaks were not implemented. I had the privilege to serve as the lead of the WHO Secretariat of the Review Committee of the International Health Regulations in 2015 and saw firsthand how united researchers were in their assessment. Health promotion can be a driver in a fundamental review of how societies can be redesigned to address both sides of the same coin, how to prevent risks that would lead to a next pandemic, and how to create a world where all people enjoy healthy lives and well-being, living in a healthy, safe, and supportive environment as members of an inclusive society. I'm happy, therefore, to share with you that the WHO Director General, Dr. Tedros, will make health promotion and well-being his first priority for his second term in office, should he be re-elected at the World Health Assembly in May. So, what are the core dimensions of future global health? Our challenge is to reinterpret, revitalize, and reimagine the founding vision of WHO for our modern world. Realizing this vision requires a paradigm shift in all countries in how health is seen and how health is financed. Far too long, health has been compartmentalized and deprioritized nationally and internationally. It's time to recognize that if we fail to invest in health, we fail to invest in the future. Let me outline 5 key priorities for the world and for WHO as we move forward. First, to support countries to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing its root causes. The pandemic has demonstrated that we must elevate protecting and promoting health as a top priority with significantly increased investment in countries and at WHO. The highest attainable standard of health does not only mean the highest attainable standard of care. It means keeping people healthy and preventing the need for care. It means true healthcare, not sick care. It requires empowering and enabling individuals, families, and communities to make healthy choices. And it requires governments to create the conditions in which health can thrive by addressing the root causes of disease that lie outside the health sector, all the determinants of health. In particular, it requires radical action to safeguard the health of the planet on which we all live and life depends by addressing the existential threat of climate change. Such a shift could cut the global disease burden in half, but it would also offer massive economic gains by reducing the burden of health systems and increasing the productivity of populations. The second priority is to support a radical reorientation of health systems towards primary health care as the foundation of universal health coverage. That means restoring, expanding, and sustaining access to essential health services, especially for health promotion and disease prevention, and reducing out-of-pocket spending. It means focusing on the least served, most vulnerable populations, especially women, children and adolescents, migrants and refugees. It means ensuring access to vaccines, medicines, diagnostics, devices and other health products. And it means investing in a health workforce with the training, skills, tools, safe working environments and fair pay to deliver safe, effective, quality care. The third priority is to urgently strengthen the systems and tools for epidemic and pandemic preparedness and response at all levels, underpinned by strong governance and financing to ignite and sustain those efforts, connected and coordinated globally at WHO. Let me go a bit deeper into the first of WHO's priorities. So what does this mean in today's and tomorrow's world? First of all, it means to reorienting the health system. I just mentioned the tremendous opportunities to prevent some 65% of global disease burden through ensuring healthy environments, safe and supportive societies, and investments in disease prevention and health promotion to ensure healthier lifestyles and reduced risks. Unfortunately, this potential is not realized by global health investments. Investments in broader population-based disease prevention and health promotion programs are underfunded even though they yield high returns. For example, WHO's best buys for NCDs, so non-communicable diseases, include cost-effective policies to reduce tobacco and harmful alcohol use, address unhealthy diets, and increase physical activity, even though they provide returns on health many times over. For just $1.25 per capita, these interventions could be scaled up to reach 50% of people in low and middle income countries, yielding a return of $7 for every $1 invested. Access to improved sanitation is another example. It provides a return of $5.5 per $1 invested, and yet some 2 billion people worldwide lack access to basic sanitation, while diarrheal disease remains one of the biggest childhood killers. Increasing spending on prevention and health promotion with a focus on cost-effective solutions will help to improve health outcomes, reduce healthcare costs sustainably, and contribute to broader social, environmental, and sustainable development goals. The second thing is to influence transitions. Ensuring health and well-being in the 21st century requires us to address health in the context of the major global transitions in demography, urbanization, energy use and climate change, food systems and nutrition, epidemiological trends, and rapid technological change. In addressing these transitions, we need to be proactive, not only mitigating risks after they occur, but also proactively bending the curve of trends to reduce health impacts and optimize co-benefits. Just as an example, in developed countries, some 50 to 70% of people with internet now go online as the first point of health information in developed economies. In developing countries, smartphone ownership stood at 42% in 2017, and social media use continues to rise. Artificial intelligence and digital health can serve as important tools for improving data collection and triage, training, predicting future health events and risks, as well as behavior change. Nevertheless, privacy concerns are also a key digital health issue, and social media can have negative impacts on mental health. There is vigorous debate over the safety of some new technologies, such as 5G telephony, which, while e-waste created by throwaway technologies constitutes a growing environmental health threat among the poor of the world's sprawling cities. Clearly, these transitions are all closely interlinked, as are the economic, environmental, and social systems that underpin the way our societies function. And these transitions all have both positive and negative health impacts. As a health promotion community, we can actively support policymakers who design the legal marketing and trading frameworks for goods and services, what is healthy and what is not. In disease prevention, we often tell people what they should not do. Don't smoke, drink less alcohol, eat less sugar and less fat. So perhaps we can change that tide, and I'm coming to that just in a second. A third way of looking at health promotion is to address financial flows and legal environments. In WHO, we are actively supporting pension funds from disinvesting from tobacco. We are working with governments to raise taxes on tobacco, alcohol, and sugar-sweetened beverages. We are working with governments to ban tobacco advertising, limit alcohol sale, and negotiate with soft drink companies to lower their sugar concentration in their products. Colleagues, in disease prevention, we are often spoiling the party for many investors who want to make a quick buck. But going forward, we need to throw a new party. In health promotion, we are looking at the things that positively influence population health. For example, sovereign wealth funds, pension funds, and impact investment funds collectively manage about $52 trillion in assets. Allocating a portion of these investable funds to investments that positively impact health will certainly contribute to healthier populations. Identifying those investments that are good for global health helps to reduce the currently high costs for individuals, families, and communities, society, the economy, and the planet that occur through current investment policies. Going forward, we will be engaging multilateral development financial institutions, the private sector, capital markets, and the banking community to ensure that borrowers adhere to activities that promote health and well-being. For example, large infrastructure projects are currently not done with active transport, such as walking and cycling, and road safety in mind. Using fiscal and legal tools, one can develop a system of incentives and disincentives with appropriate risk-sharing arrangements to encourage health-promoting lending policies and practices. Going forward, we will be engaging regulatory authorities, including banking and securities regulators and investment authorities, in sustainable pro-health market-shaping policies. We will assist them to provide regulatory incentives and disincentives to entities under their jurisdiction that will promote health. This includes providing regulatory incentives to the institutions that have a positive impact on the common good. For example, investors that comply with environmental, social, governance, and health criteria. So this is a system that currently banking investors are looking at whether the investment indices are environmentally, socially, and governmentally sustainable. And we are actually working with those banking investors to add the health component to that. Banks that lend to health promoting industry would be subject to lesser regulatory reserves. Environmental regulation would be structured such that the true costs of environmental impact is reflected in the costs of a project, including the application of the polluter pay principles. Fiscal incentives such as subsidies or tax breaks would only be provided to health promoting industries. Going forward, we will be engaging partners to advocate for corporate governance reform to make the board more accountable for actions that impact on public health. Multinational corporations are among those selling health-harming products and should be made more accountable for their actions. WHO supports those corporations that move away from a shareholder-centric position to one that takes into consideration other influences, such as population health gain. While we acknowledge that this is a very different way to look at business, business leaders increasingly see the value that stakeholder value offers huge potential to drive very different strategies and outcomes. Emphasis on short-term financial returns should be discouraged of more long-term returns, which complies with these ESG criteria. Going forward, we will provide fiscal and legal technical support to member states considering fiscal measures and other pro-health market shaping policies affecting health. The provision of subsidies or tax breaks for health promoting activities such as sustainable transport, exercise and sports participation, as well as the consumption of fruits, vegetables, and healthy diets, offer tremendous opportunities to help consumers make the healthy choice. WHO supports initiatives to remove subsidies for fuels, as well as those activities which harm the environment. The aim of this support is to provide an enabling environment to make the healthy choices the easy choices. Finally, we continue to engage partners to promote collective action for health and well-being. An empowered citizenry is essential for people to enjoy the highest attainable standard of health and to make governments accountable for the health of their people. WHO will continue to engage partners in health literacy, strengthen participatory governance and health in all policies in support of legal and fiscal measures affecting health, and help ensure that informed consumers support an enabling environment for healthy choices. All these efforts require solid research. For instance, while we know that investments in the tobacco industry support suffering and death, what would be the healthy investments that bank could promote instead? What are the health effects of current digital transition and that we will see in just a couple of years yet? What review structures should be established to address the ever faster innovation and digital transition? For instance, how should we advise major digital initiatives such as metaverse so that they will contribute to health and not to more sedentary lifestyles? Should we continue on a case-by-case opportunity, or do we need an agreed process to assess health effects before new technologies are marketed? Dear colleagues, health is a compass for development and barometer for a nation well-being. As money makes the world go around, we need to address main financial flows. To create a world that is better preventing a new pandemic to disrupt the world, the risks and their conditions need to be addressed. To develop a healthy economy, we can and must be supporting the industry and enable them to make the healthy choice. And I thank you.